Money we receive from private health insurers is very important in supporting the provision of services in our hospitals. We were very keen to work with the Behavioural Insights unit to explore new ways of supporting patients in making the choice to use their insurance and helping them to understand the benefits, not only to them, but also to the hospital. The trial was about trying new ways of supporting this patient choice and working with staff and patients to overcome all sorts of barriers.
So like most hospitals, about 50% of our patients enter the hospital through the emergency department. And Western Sydney, and in particular Westmead, had about 15% of our patients choosing to use their private health insurance. Now this is lower than the state average. The state average for most people going through an ED is about 20%. And it's really important for us because the revenue that we actually generate from privately insured patients allows us to invest in our infrastructure above what we actually get funded in our core revenue. So we actually get to do those extra touches that benefit the staff and actually benefit the patients. And it's really important, particularly in an area such as Western Sydney, where our population is growing all the time, that this is an important part of actually keeping up with the patient activity.
So Westmead Hospital had lower than average private health insurance use, and we really wanted to understand why. So with all our projects, we go out and do detailed field work. And we spent about 3 weeks in Westmead Emergency Department working with staff and patients to really understand what the behavioural bottlenecks are, as well as the triggers for using private health insurance. Worked with hospital staff, we reviewed the Behavioural Insights literature, and we used our EAST framework, which stands for if you want somebody to do something, you should make it easy, attractive, social, and timely. For example, for patients, we introduced a gift bag, which provided an immediate and tangible benefit to them. For staff, we reinvested a portion of the revenue generated for the trial back into the emergency department to spend on items of their choice. We made the process social by co-locating revenue staff with clerical staff so they could work as more of a team environment. And finally, we made it timely by providing clear messages to patients at the front door around the fact that they would not be charged out of pockets.
The project has made things easier for my staff. Prior to the trial, it was actually quite time consuming when admitting a patient. There were a number of forms that actually had to be filled out and signed by the patients and the relatives. As you can imagine, the emergency department is quite overwhelming for patients and relatives at times. The last thing they want to do is think about having to sign a number of forms. The forms are now auto-populated and there are fewer forms for the patients to actually sign, so it's making it easier for the relatives and patients. The project has also made things easier for my staff in by the clerks don't always have the time necessary they need to spend with the patient answering the number of questions that they have. By introduction of the PLOs into the emergency department, they're there at the front door. They're there, they can give the patient a clearer understanding of the benefits of using their private health insurance through the emergency department.
Our rate of private health usage inside the emergency department has gone up 3.9%. Now, 3.9% is worth about $1.7 million in extra revenue and reduction in cost for us by having these additional patients convert and use their private health insurance.
So the benefits that have been brought by this trial is to reinvest the revenue back into the emergency department, which is great for us nurses because we can afford more life-saving equipment. We've been able to renovate our tea room and we have more staff.
The Auburn trial is looking to replicate some of the same innovative solutions that we've adopted at Westmead Hospital. It's been going for a couple of months now and we've already seen some really good improvements in patients making the choice to use their insurance. It's really good to see that some of the ideas we've had at Westmead can be repeated at other hospitals in the state.
I think one of the really strong attributes of what we've done through this initiative is that it's actually been led by the grassroots staff of the organisation inside the emergency department, that the nurses, that the administrative staff have gotten behind this and actually driven it themselves.